Today, I'm diving into changes to Medicare Part B for 2023, so stay tuned. If you are new here, my name is Stephanie Apt. I'm a licensed independent insurance broker, and my team and I help seniors all over the country to navigate the world of Medicare. And in today's video, I'm going to be reviewing some of the upcoming changes to Medicare Part B that you definitely want to be aware of. We'll cover changes to Medicare Part B premiums, as well as changes to Medicare Part B enrollment periods and how they could affect you. As always, if you like this video, please take just a moment to subscribe to the channel. You can click the like button and definitely leave any questions you have for me in the comment section below. I'll be sure to try to answer those. And if you have suggestions of video topics that you'd like me to go over, go ahead and leave them in the comments below. I really appreciate having you here. I love hearing what you all have to say. So Medicare Part B, if you're not already familiar, this is the part of Medicare that includes your medical and your doctor coverage. I talk all about Medicare Part B in this video up here, so be sure to click that video, watch that if you want to learn all about Medicare Part B. But one important thing about Medicare Part B is that unlike Part A of Medicare, Part B isn't free. You do have to pay a premium to be on Medicare Part B, and that premium can change over time. In fact, in 2022, the Medicare Part B premium increased $21.60 per month, up from 2021, which was the largest increase in the program's history. Now, one of the reasons that CMS cited for this very large Part B premium increase was that CMS built in a reserve in the Medicare Trust Fund to cover Aduhelm, which is an expensive Alzheimer's medication.
The US has spent billions on research, but still hasn't been able to develop a drug that targets the cause of the disease.
We know that it's a costly disease, and the burden of that cost continues to grow exponentially.
A drug for any company that could treat Alzheimer's successfully would be seen as just a goldmine for Wall Street and a huge gift to society.
Now, one biotech company thinks it's cracked Alzheimer's tricky code in a drug known as aducanumab, now sold as Aduhelm.
Now, at the time that CMS released this Part B premium increase for 2022, the cost of this medication was projected to be a certain amount. And since then, the new projected costs from this drug manufacturer have actually been cut about in half. Now, CMS has determined that the best way to reflect these new savings is in the recalculation of the 2023 Part B premium. So while you won't see any decrease in your Part B premium yet in 2022, hopefully those savings are going to be passed along to you in the form of a potential Part B premium decrease in 2023. Now, we won't actually know what the Part B premium is until fall of 2022. That's when they'll release the information on the Part B premium for 2023. And as always, we'll keep you posted on what that new Medicare Part B premium will be as soon as that information is available. Now, another big change to Medicare Part B for 2023 has to do with Medicare Part B enrollment periods. So CMS has released a proposed rule, and I've linked more information in the video description below, that would change the effective dates of your coverage for traditional Medicare based on when you enroll. It would also authorize special enrollment periods for certain Medicare beneficiaries for Medicare Part B, and it would extend Part B coverage for certain medications for kidney transplant patients. All of these are very good things that hopefully we can expect to see starting in 2023, but I want to break down a little bit more about how these coverage effective dates are going to be changing. To start with, everyone gets a 7-month initial enrollment period, also known as the IEP, when you first turn 65, in order to enroll in traditional Medicare Parts A and B. Now, the way it's set right now, if you enroll in the latter part of your IEP in those 3 months after you turn 65, your Part B effective date can be delayed. And so you can see on the screen, this is the way it works right now. And a lot of people aren't aware of this, and it can get pretty tricky, especially if you are retiring in those few months after you turn 65. For some people, you can risk a potential lapse of coverage, and many people don't realize this and can confuse their coverage effective dates. The good news is that this new proposed rule would make your Part B effective date just be the first day of the following month if you enroll in the latter part of your initial enrollment period. So there'd be no delay in your Part B coverage starting. It would just start on the first day of the following month based on when you apply. Additionally, right now, if you miss your initial enrollment period and you don't have other creditable employer-based health coverage, then you generally have to wait until the Medicare Part B general election period to apply for Medicare. And that's annually between January 1st and March 31st every year. The way the law is set right now, if you apply during the general election period for Medicare, then your Part B coverage doesn't start until July 1st of that year. And you're gonna face penalties for every month that you should have had Medicare Part B and you didn't. So a couple great things about these new proposed changes is, first of all, a new special enrollment period is going to be available for people that missed their initial enrollment period and can demonstrate that their employer misrepresented information on a timely enrollment. So maybe didn't let them know that their coverage wasn't creditable. And in this case, they could go ahead and just apply for Medicare Part B at any point during the year, as long as they can prove this, and they won't have to wait for their coverage to begin. Now, also, even if you don't have a special enrollment period like that, and you do have to wait until the general election period for Part B to apply, you'll no longer have to wait until July 1st for your coverage to start. Your coverage is going to now start the first day of the next month based on when you apply. All of this is good news and really just seems like common sense when it comes to these enrollment periods. So we're excited to hopefully see those starting in 2023. There are other things included in this rule, like special election periods for folks that are experiencing weather-related disasters and emergencies. And I've included all the information on this proposal linked in the video description below. So feel free to check that out if you want to learn more about it. Overall, it looks like these proposed changes will definitely have a positive impact for those on Medicare, helping them to secure coverage sooner and avoid penalties. So please go ahead and share this video with anyone that you think may benefit from this information. And as always, my team and I are here to help with your Medicare insurance needs. We are licensed in almost every state, and our service is 100% free of charge. Please feel free to give us a call at any time. Thank you so much for watching today, and we'll see you soon.